welcome everyone to, I think it's our third to last final webinar for the Innovation Scouts. It's really great that you're able to make it with everything that's happening at the moment. I've just been speaking to a couple of you, and it's interesting what work that you're doing, and even more a reason for us to think innovatively at this time. So the topic of today is pace into innovation. It is a webinar, so what we'll be doing is asking you to raise your hand so that we can unmute you if you feel like you'd like to add anything. At the end of each of our presentations, you'll be able to ask questions. I'm also going to be manning the question and answer chat during the presentation, so feel free to pop in there. We are keen tweeters for our SINs, so we've got a few for you today. The innovation agencies is innovation_NWC, and we love using the hashtag Innovation Scouts. We've got Deborah Renwick from Elemental today that's going to be presenting, and Elemental's is there, and we've also got Andy Kearns, who's going to be with us from the Innovation Agency's commercial team. The webinar is going to be recorded. The slides will be sent out to you. If you're registered via Eventbrite, then it'll come through to you through that route. I will invite you to sketchnote and capture your ideas. I'm a really big fan of sketchnoting, not only to make things a little bit more fun, but it helps us with our memory and it's great to share. So I'd love to see a sketchnote of today. That would be fantastic. You know, I'm right there with you doing that. So the first thing that I'd like you to do is type into the chat. Now, it's really important that in the chat you put to all panelists and attendees. So make sure that you click that so everyone else can see. And I've just been on one of our calls, which I'm going to talk to you about a little bit later in the webinar. But one of the things that we looked at today was the disposition of innovators and what it is that we actually need to be great innovators. So I thought it would be a nice little icebreaker for us today. So there's 5 different dispositions that are here. Curiosity. What are we curious about? What are in our thoughts when we're at work? What could we maybe do differently? Or who could we speak to that changes our perspectives? Creativity. What are we doing differently? How do we synthesize things to get new outcomes? And it doesn't necessarily mean that you're Picasso and you can pick up a paintbrush and start drawing. It just means that we can do things in different ways, from cooking to changing the way that we work. Perspective. So Jen Cohan, our lead head of programs for the Coaching Academy, always talks about whether oh sorry Helen, check on mute, not getting normal options yet, so you're all muted at the moment, and them options will come if you raise your hand. We can unmute you, but if you want to type in the chat, that would be great. And so we always talk about the empty chair. Who is not in the room? Who needs to be in the room? What other perspectives do we need to take on board? Flexibility. What can we do? How can we bend? How can we change things that we're doing in terms of, working hours, or it might even be the way in which we treat patients, or work together, changing different skills, seeing who can do what in the team. And then the final one is courage. What courage do we have? Is it about speaking up, about changing things, working in different ways? So I'd just like you to write in the chat, and don't forget to when you've got that function up, that you can see all panelists and all attendees. And I just want you to think which one of those strikes you at the moment. Which one of those is it that you'd really like to develop, or that you are developing? So if we just spend a couple of minutes typing what we think. Lovely. So we've got Steve, curiosity. I wonder if you could elaborate on that a little bit further. Yeah, Helen likes the empty chair. Perspective, the ability to see the perspective. Present is important to me, absolutely. Curiosity, wonder what it would happen. if we tried this, broke that rule, asked a different question. Creativity big time. Approaching things in a new way is the heart of innovating. I agree, absolutely. How to be creative in ways in which, you know, what can you put together? How can you make do and mend at times is really essential. Constantly looking at how to do things differently with limited resources, absolutely. I love that concept as well, Jane. Stretching red tape. These are really great, and we'll save these in the chat and we'll tweet them and we'll do things with them so that we can see them later on. That's brilliant. Okay, keep them coming. So the lineup today, I've got an introduction and a quick update from the Innovation Scout Network and the Coaching Academy, the work that we've been doing over the past few months. We've got Deborah Renwick. We're really happy to have Deborah. She's a partnership manager from the North of England and Scotland for Elemental. Elemental is a great company. I don't want to tread on Deborah's toes, but definitely we're going to find about how they've managed to create their organisation, how that's really developed, and what helped them in terms of that pace into their innovation. We've got the fabulous Andy Kearns. He's our programme manager for Cheshire and Merseyside at the commercial team. He's going to be talking about how much support is out there really from the Innovation Agency. And you'll notice that after Deborah and after Andy, there'll be chance for question and answers too. And we'll do that through the Q&A. So you should notice that at the bottom, that option. So a quick update from me really is about the programmes that we've been running, and I see a few of you that have already been on here. Helen, I absolutely love this. I've not had a chance to reply to you, but I thought your tweet was amazing. Sorry to embarrass you. But the first of our online programmes that we're running is a 12-week programme called Innovators Mindset. It really does take you into some of those questions that we started the webinar off with today. How do we become great innovators? How do we work within that red tape? How do we disrupt the system? That's also complemented by coaching and collaboration sessions that we hold every Wednesday, but really an opportunity for you to connect to other people, to see what's happening across our system, not only where we work, but we have people from all over the country that join. Another example of that is the tweet from the running granny, is Angela from the company Go for Old, and she's really written about her reflections on the programme. So you can see Helen and Angela's on the screen there. They're the tweets, and you can find more about that on Twitter. The second programme that we're running is Evaluation for Innovation. So if you at the stage where you've got an innovation or you're really curious to see what evaluation support is out there, then Laura Boland and staff from the Innovation Agency have put together a really interesting programme. It's a 6 to 10 week course. It's again run online with supported coaching from Sian Taylor. And this is really to delve into some of the things that we may know that innovations are working, but how do we evidence them? Things like cash, non-cash releasing savings, those terminologies that make my toes curl under because I don't quite understand. So it's a great way to really introduce yourself to that. It's a very basic course. It's supposed to be at entry level, but it's for those that really have a project to work with and work alongside. We also have innovation coaching and collaboration sessions, as I said, that run every Wednesday, 11 till 12, not just for the Innovators Mindset students, but for anybody that wants to collaborate. That space is there for you, and we'll share those details in Eventbrite links after this webinar. If you've got any questions about any of the information today, the best email address is to send to coach@innovationagency.nwc. I've totally spelled that wrong, haven't I? nwc.nhs.uk, it should say. And in terms of when those programs are starting, we're already on the way for Innovators Mindset, started in November. But if you really wanted and you was itching to get on that program, we could offer you a place. And we've just started, and I think it'll go live next week, for Evaluate Your Innovation. So you're just in time to get onto those, and we can help catch you up. But it will also be running early next year. I think Innovators Mindset will start in March sometime, and Evaluate Your Innovation will probably be before then. So just a few offers of support from us. So something that's in the pipeline as well that I'll be leading on is another community of practice to get our teeth stuck into, but this time it's a national community that has been funded by NHSX, and it's all about digital. It's about, there'll be 3 themes for these communities of practice. The first one will be care homes. The second one will be digital inclusion, exclusion, and the final one will be improvement around digital initiatives. We'll be offering lots of coaching and collaboration opportunities, as well as really trying to increase that capacity for some of the digital implementations that are happening. And as the topic of this webinar is pace into innovation, I think communities of practice can be a really key part of that, to drive innovation and create a link from communities of practice to organisations to get those voices heard. And again, we talk about that empty chair, who needs to be in the room, and this is a great way to do that. You'll see some joining details and information that will come out about this shortly, but again, if you've got any questions, please contact us at coach email address, and then we can get into some of those details. So again, anything that you want to know about the support that we're offering, please do reach out. So it takes us to us, what we're doing. The Innovation Scouts programme is going to be reworked at the end of December for the new year. We're going to be looking at strengthening our coaching and mentoring opportunities, as well as really developing that innovation pathway. Laura Boland is again looking at that innovation pipeline, which is going to be a really useful tool for us to use through the work that we're doing and also the work that you're seeing. Our list of priorities we'll revisit. This one is around pace into innovation, but we also know that there were 10 other priorities that we looked at. We've tackled some of these within our webinars, but we will be getting together soon. There'll be a new date out for us to collaborate and meet in March, because obviously we won't be able to do that face to face, and I think it's a safer option to design it online in the first instance. But I wonder if, you know, thinking about this list of priorities, have they changed for some of us? Are they, you know, are they sort of still resonating with you? And if not, what do we need to add, or what can we take away? Obviously, this was pre-COVID, and it'd be interesting to see how that has actually impacted some of this. So this is the map that we discussed and we put together as a group. These are things that we've looked at, the digital, how do we link in those communication channels, patient education. There's really some interesting conversations. Rahima from the wellbeing, the life rooms in Merseycare came on to talk to us about those. And if you missed any of those 3 webinars that are on the screen at the moment, then definitely get in touch with us, because we can share that learning again with you, and there's lots of interesting information on there too. So it takes us to our pace into innovation. So how does pace into health and care innovations benefit organisations, staff and public? We're going to really look at today ways in which pace into innovation have achieved, and what were the key factors that ensured that pace. And we're going to look at the research into pace and innovation through what methodologies we've got internally as an innovation agency, and also hear this great story from Deborah around the work that Elemental have been doing. So really that leads me there. I'm going to stop sharing. I'm going to introduce Deborah from Elemental. I'm going to ask you if you'd like to share your screen, Deborah.
I will do. Thanks, Carla. Just make sure that comes up before I start.
No problem.
Been a bit slow today. Does that come through now?
Yeah, it just needs to go on slide view. I think that's all that's left to do. Thanks, Deborah.
Marvellous.
Lovely. So before you start, sorry, Deborah, if you can just remind everyone there's question and answer option, and you can also send a chat to the panelists so you can ask questions through that route. We will be taking some of those at the end of Deborah's presentation. So, you know, think about this opportunity and what you'd like to get from it. Thanks very much, Deborah.
Lovely. Thanks, Carla, and the team for inviting me to speak today. And thank you for taking the time out of your busy day to attend this morning's session. As Carla said, I'm Deborah Nick. I'm the Partnerships Manager for Elemental, covering the north of England and Scotland. And I'm going to spend a little bit of time setting the scene around who and what Elemental is. And then we're going to focus on the key factors in building pace and the spread of the Elemental platform. So the Elemental story starts in 2013. Derry's the city of culture, and health and wellness are a major feature of this. Jennifer Neff and Leanne Monk are community development workers in the city and have come together for the first time. They're keen to reach out and promote all of the wonderful services available to the people of Derry. They don't know how to do this efficiently. So they come up with an idea of making this digital to connect the city. Everybody was working in silos. The people who needed the services the most were walking past the very buildings that were offering the services they needed and would benefit from. They'd also seen in their communities that the doctors, nurses, social workers, occupational therapists, physios were all trying their best to give the people the best chance at life. And equally, they as community workers were also trying their best. They didn't realise it at the time, but what they were actually talking about was social prescribing, hence Elemental was born. Our official launch was at the NHS Expo in 2016 after 3 years of researching and developing what was needed to help areas to establish and scale a social prescribing model of care. We saw our first customer go live in 2017. Today, we're a team of 32 people who genuinely care about community health and well-being and want to stop health inequalities in communities across the UK, Ireland and beyond. So to summarise and highlight the 5 key reasons Elemental was founded, as social prescribing is built on several component parts. So we've got to promote better partnership working, to play a significant role in the reduction of health inequalities, to maximise the impact of population health management, to provide a co-designed health pathway with a patient at the centre, and finally, to demonstrate the impact that all contributing organisations play in improving the health and well-being of the population. Elemental was born out of necessity and a drive to support the whole social prescribing ecosystem in the best way possible. We've been able to grow not only the business, but also our product offering at pace because of the following factors. Being the brainchild of community development workers from the start means that as a business, we truly understand the demands, frustrations, limitations, and constant battles faced by our customers and their clients. Within the Elemental family, there are several of us who also come from either a community link worker or an NHS background, so fully understand and appreciate the day-to-day pressures being placed on our customers and their customers. Not only do we respond to the suggestions submitted by our customers on how our product can be grown and improved, but we also look at the wider requirements being placed on our customers by the government and their commissioners. We're the first social prescribing platform provider to be awarded onto the GPIT Futures Framework. This makes it easier for our customers to procure us as a framework and gives them confidence that our product, services and processes have been reviewed and approved by NHS Digital. We responded to the national DES requirements for primary care networks, supporting the rollout of the social prescribing link worker by developing a mechanism for GPs and their staff to easily refer into Elemental, and also developed pushback functionality, which files back the required SNOMED code into the GP clinical system, enabling payment. We also integrated the patient activation measurement tool within Elemental, making it easier to calculate the patient's measurements as a means to supporting them through their journey. We've also developed the data exporter, which allows the Elemental data to be knitted together with multiple external data sources to understand the impact social prescribing is having on the community. Our product, through its evolution, is now capable of supporting any permeation of deployment, from small charity-run services to large-scale deployments like we have across Greater Manchester. And this has been made possible and easier by constant development. Projects can adopt our self-referral module, which makes it easier for patients to refer themselves into the service, which we found invaluable during the first outbreak of COVID-19. As a company, we have and continue to grow at scale. Although a relatively small company, we have a structure that supports any future expansion of the business, with a dedicated sales team, account management team, technical support team, training team, product team, developers, marketing, and HR and finance, all underpinned by a robust set of processes and procedures, making expansion a simple progression. Integration. So as a business, we understand we can't provide our customers with everything they need or want, and as such we have a partner program which enables those companies and their products that give our customers a better experience and opportunity to integrate with us. We currently support GP clinical system integration and directory of service integration for any customers that already have a robust and trusted directory of service that they want to maintain when they implement Elemental. And through this integration, we're also starting to see real connectivity. Several of our customers are starting to work together, integrate their offering across a region, offering a truly joined up way of working that can only benefit their clients, patients, and the communities. We'll see in later slides the evidence surrounding the impact Elemental and our customers are having in tackling the health inequalities faced by our customers and their clients, as well as demonstrating the growth and the uptake of the product, which in turn will help our customers and their commissioners to truly realise the positive impact their work is having on not only their clients, but also the wider economic environment. And just to finish off on this slide, I wanted to name check a handful of awards Elemental have been awarded in recognition of not only our product, but also celebrates the power and passion behind the business, which comes from the co-founders, Jennifer and Leanne, as well as the rest of the team. Oops, just before I move off on there, sorry. So we're recognising the top 50 in the Northern Ireland Tech 2020 companies, actually coming in at 28. We were awarded the Digital DNA Best Small Tech Company of the Year, and we got winners in Founder of the Year and highly commended on that one. DigiLeaders 100, winners of the Health Tech Innovation Award, and DigiLeaders 100, we've got winners of the overall 2020 DigiLeaders 100 award. We won the Cambridge Social Innovation Prize, and finally we were winners in the AbilityNet Tech for Good Awards digital health category. So it just shows that in a small period of time, what impact and recognition we're actually getting because of that innovation and pace that we've applied. So what is social prescribing? In its simplest terms, it's about connecting people to programs, services, and events that are happening on a person's own doorstep in their community. Programs, services, and events such as Couch to 5K program, a healthy cooking program, or a mindfulness session. Social prescribing most commonly starts with a GP making a referral for a patient to a social prescribing link worker. The link worker is the linchpin in a patient's social prescribing journey, helping the patient to co-create their social prescribing package of community interventions and supporting them along the way. Elemental is the digital platform that underpins the whole social prescribing ecosystem from start to finish. Social prescribing isn't just about signposting a person to a service or an intervention or health coaching the individual or having access to a directory of service, and certainly isn't just a way of filling in somebody's time. It's so much more, and the services and interventions available grow almost every day, as does the complexity of the needs of the clients. Some clients may require very little support and just need signposting, advising of a local knitting club to help with their social isolation, whereas others may have more complicated needs and require several interventions spread over a longer period of time. In terms of what Elemental does, we connect people and services. We offer a referral channel, whether that's through integration with a clinical system, a standalone platform, or via our self-referral module. We provide a directory of service, which allows link workers and the clients to understand and engage with the interventions and services that are available to them. And finally, we provide a full reporting suite, including measurement tools and reports to monitor the uptake and impact of the services and interventions offered. Looking back at my earlier slide in discussion around the key factors in building pace and spread of Elemental, I said the key factors involved were that we understood, we were responsive, the solution was scalable, we integrated and connected, and we could record and measure the impact. This slide just demonstrates how we help our customers tackle the many challenges they face, regardless of the type of organisation they are. For example, we help to deliver on the PCN DES funding, establish a robust list of all local services and interventions available, support quality assurance on providers, allow link workers and patients to track and monitor progress, provide an easy referral process, support remote working, which is very crucial during COVID-19, where a lot of our customers historically have been using paper-based records and therefore would have been speaking to their customers blind. So by enabling Elemental, it's given them the platform with all of their records on for them to refer back to during this period. And also we're able to track project outcomes to prove value for money. So who uses Elemental? We classify these into 5 key headings. We've got referral agents, GPs, social workers, paramedics, housing officers, and many more use Elemental to refer their patients. Referral handlers, the social prescribers, link workers, development workers. They have many names, but regardless of job title, they're the people who work with the client on a patient-centered plan, track improvements, and prescribe or recommend interventions. We've got the providers, those who are providing the advice or the service to the patient. They use Elemental to promote their services, log attendance, and in a lot of cases, help to maintain the validity of the directory of service. The clients themselves use the self-referral module, monitor key stats, and review and log attendance at upcoming classes or interventions that they've been referred to. And finally, we've got the super users. They could be the commissioners or managers of the service, and they've got access to our extensive suite of reports to help monitor caseload, engagement, and impact. We support customers from a variety of sectors, including but not limited to health, local government, universities, prisons, charities, and housing associations. This slide shows how we support from very large economies to the smallest of customers, from a regional deployment like we've got in Greater Manchester to smaller organisation deployments. Most of our larger deployments started as smaller projects, and due to their success, they grew into something bigger. Our deployment across West Lancashire started as a small PCN deployment in Skelmersdale. Our Greater Manchester deployment began in Tameside and Glossop and grew and now includes the likes of Ingeus, who are providing employment support not only in Greater Manchester but other areas across the UK using the Elemental platform. So I mentioned on the last slide the types of organisations who use the Elemental platform, but this map shows us where our customers are in the UK and Ireland. This number continues to grow and the areas cover continues to spread. We work all over the UK and Ireland, connecting local authorities, health trusts, and clinical commissioning groups, housing associations, charities, social enterprises, prisons, domiciliary care teams, social care, secondary care, and most recently universities, so that people can have better mental health, feel less socially isolated, be more physically active, age well, and stay at home for longer. I'm just going to highlight some of the key figures in this diagram, which demonstrates those being connected and supported by Elemental. So since 2017, we now have 7,429 referral agents using Elemental to refer their patients into the link workers. We've got 1,284 link workers using Elemental to support their clients. 62,225 clients are being helped through the Elemental platform, and we've got 519 individual hubs set up and supporting the clients. Back in March, when we ended our first phase of lockdown, we were asked by our customers to develop our self-refer option, which took away the need for the customers to be referred in by a GP or other referral agent. We developed this at pace, and the patients or their carers were quickly able to refer into the service. The service providers themselves were quickly able to deactivate those face-to-face led services, and also react quickly and add new interventions on that were needed to support their customers. We saw food banks added to the lists that weren't necessarily there before, lots of befriending services to support those socially isolated. Elemental had already been developed to support the rapid change in our customers' needs, which made this much easier to apply. We've been able to measure the impact this change in services had for the patients, the community, and the wider NHS economy. So following on from the previous slide, we've had some fascinating stats that show that since COVID first hit us, the huge increase in the numbers around our users. There are 20,000 more patients being managed and supported in the Elemental platform. 516 more link workers are now using Elemental, and 3,209 more referral agents are using Elemental. So looking back at the beginning of the presentation around the pace and spread of Elemental, we're now focused on integration. We currently integrate with the three main GP clinical system suppliers in the UK, which saves the GP and their staff from having to use another system. GPs are always keen to cut down on the number of clicks it takes, and with integration, they can have a referral out of their system and into Elemental within 3 clicks and in as many seconds. As part of our understanding the requirements of the customers, we worked with Insignia Health to integrate their patient activation measurement tool within Elemental to make it easier and more efficient for our customers. We're also working with Serverlec to integrate with their Rio and Mosaic systems, and have started discussions with Liquid Logic to integrate with social services. By integrating with best of breed systems, we're enhancing our core offering and our customers' experience. So what does the future hold for Elemental? We'll continue to grow our customer base and our spread. We'll have further integration with secondary social care and any other systems where our customers feel there is benefit in integrating with. We'll continue to support our customers in demonstrating the impact they and their services are having on the population. We'll always stay a step ahead of the game with regards to any requirements placed on our customers, so they're not at a disadvantage when changes are applied or new requirements are introduced. And although we've come a long way in a short period of time, we know we still have so much more to offer and enhance our product with. We'll continue to look at innovative ways our product can be used inside and outside of our current customer market. So that's it from me. Thanks for listening. And if there's any questions, I'm just going to stop sharing and we'll go back and pick up any questions that have been put forward.
That's great, Deborah. So interesting. And I think the first sort of thing from me is really to see how much how many opportunities are available now for people to actually reach out. The first one is around, you know, the actual social prescribing mechanisms that are in the community. What do they go through in terms of being introduced to Elemental and to actually be on that online system?
I think each project deals with it differently. Some projects we go into, they've already got a really defined, robust directory of service where all of these agencies' services are already known to the area. Whereas some we go into and we're basically starting with a blank page, and it probably gets built up through word of mouth. Someone's heard about a service, someone's heard about this help that's available, and we build it up. But I guess we're keen when we deploy anywhere to get engagement from across all key stakeholders, so everybody's involved from the start and can promote their services, because there's so many fantastic services out there. And I've been on a number of webinars recently where there's a lot of small charities really frustrated that they're missing opportunities to promote their services. So I think it's all about reaching out to as many as possible and including them from the beginning, because there are so many wonderful services available from these charities.
Yeah, and so if I knew of somebody in my local area, say for example, what would be the route into that? Would I then contact would I get them to contact yourselves directly, and then would that start the process?
It can do. We're obviously not in control of that directory of service for that particular area, but what we're keen to do is introduce that new provider to the project and have them decide if that project can actually go on to that directory of service. We are actually in discussions, and we're probably some way off, but of actually looking at an Elemental directory of service as well, where these providers can come to us and we provide that as part of a core package that at least puts these new projects off on a bit of a better footing and understanding what is available, because a lot of the time they understand what is available from what they've already used, but aren't necessarily aware of what's widely available in their area. And there's a lot of national organisations as well that can offer online services. So we're not really restricted to what's happening in your area. There's lots of fantastic opportunities out there for one-to-one reach via Zoom. I know that we're so used to it now.
Yeah, sometimes to our detriment, isn't it?
Exactly, yes. I'm keen and eager to get out and meet people again and not just see them as a television screen.
Honestly, I agree with you. So Gordon has posed a really good question, and I was actually thinking this as well. You know, with the best will in the world, how do the databases keep current? He also says that we're guilty of not changing contact details when people move on, and there's all sorts of different things that happen, isn't there, that changes. So how are you finding that works in your reality of Elemental?
In reality, our directory of services today is just a directory of service. There isn't the facility to send out a review, but I know that it is now on our development roadmap to do just that. So when an intervention is added, we will be then setting a review period on there, and that will send a notification out to the owner of that service to review it and make sure it's up to date, because especially during COVID, there's been a lot of services actually taken offline because they were face-to-face services. Yeah. And a lot of new services have been introduced because they were needed to support people remotely. So we're tackling that by actually developing our directory of service even more. And it just shows that the reactiveness that we have with our customers when they're asking for things. So yeah, we'll be dealing with that through that review period.
Thank you. And we've got, I hope that answers your question, Gordon. And we've got a question from Andy Kearns to say specifically about the Northwest Coast. And I know that you've shown us that map, which was really useful, but what is the work like in terms of Elemental, the collaborations that you're having within the Northwest Coast, which is, you know, everything excluding Manchester, really?
Yeah, so, well, we've got the work going on in West Lancs, and we're working with, well, we work with a number of organisations, but predominantly we've got CCGs and CVS organisations over in the Northwest. I can't name them because I haven't been involved with them from the beginning, but we've got the likes of Mersey Care and Life Rooms, but that's just grown pretty much on a monthly basis as well. I think once word of mouth comes around about what Elemental is doing to support these customers, and I know it's not the Northwest, but Wales is over on the Northwest. We've got a number of individual customers that we decided to have a joint meeting with them last week, and as isolated customers, they've decided to come together and work together as one. And Elemental supports that integration between those hubs as well. So where they've got shared resource and one provided a service that another didn't, they're now able to actually share their information out and actually become a bigger unit and a stronger unit because of their integration.
Yeah, so it's almost like not only are you're joining people together, aren't you, really? As you say, in ways in which they possibly wouldn't have imagined.
Yeah.
So as somebody on the system, social prescriber, you know, are they able to see what's around, what they're sort of not competitors, but who they could collaborate with too? Do you think that's been something that's been born out of this innovation? For example, if I had a social prescribing program and I seen on the system that there was somebody else with something similar, have you seen that actually naturally occur in terms of that pace of innovation, people using it for that?
In some areas it does, because that directory of service is very configurable. What we can do is actually make it so it is that the directory of service is just for you. So those services, those interventions are just created in there to support your unit. But some of those can be available to the wider unit. And absolutely, where those services are available across an area, we're absolutely seeing that people and those link workers, those social prescribers, are actually seeing services and interventions that they weren't aware of existed. So it's benefiting not just them, but their clients as well.
So I'm just going to give another couple of minutes, thanks Deborah, for some more questions to come through. You know, please put your thoughts down. It's a real opportunity to have Elemental here with us today. There's just one more from me really about anybody working within the NHS. Say for example, they've not got Elemental within that organisation, but they're still able, aren't they, to promote Elemental and to tell patients about that.
Absolutely, absolutely. And just leading on from that, what we're about to release next year is also this concept of self-management. So a GP or hospital consultant or anybody that is aware that these services are available can just point their patient to this portal and they'll be able to refer themselves in as well. So yeah, you don't have to have Elemental to know what's available and how to get into it. At the moment, to get into that directory of service, we need somebody referred in via a link worker, but in the very near future, we won't even need that intervention from the link worker. That patient will be able to self-manage themselves into a service if that's where they want to be.
That sounds fantastic. What a great opportunity. Thanks so much for joining us today, Deborah. It was really clear to see that collaboration, working together and being flexible, as you say, change your systems to work with all these different digital systems that are already in place has been key as well. So we've not got any more questions. Andy, would you like to say anything before we move on to your presentation?
Well, not on the elemental. It's just great to hear from Deborah and the brilliant work that you're doing, really. And I suppose myself and my colleagues, we do get some innovators that are in that social prescribing space, really. And I suppose just another sort of question, really, Deborah, is sort of like the link workers or the funding that's been mentioned in the long-term plan for social prescribing. Is that sort of appearing yet, or is it still many years off?
I think to support the social prescribers, the money is there. How those PCNs decide and when they decide to bring those social prescribers on, I think a lot of them probably don't appreciate what the social prescriber can bring to them. I think the frustrating part for us is that the funding is there for the social prescriber, whereas the platform is the fundamental thing that social prescriber needs to manage that caseload and demonstrate the impact, which is the same, I guess, for a lot of things.
Yeah, it's quite interesting as well how you are measuring that impact. You know, it'd be really interesting to see those metrics around, you know, what does that consist of and how does that support, you know, as you say, the NHS and social care that are within organisations.
Absolutely. So, I mean, one of the recent developments that we've just done is a data exporter, because we had a lot of customers wanting to actually measure not just the impact that their social prescribers, their link workers were having on their patients, which we can manage within the platform itself, but it was actually understanding what impact that social prescribing service was having on the wider economy. So by enabling them to take that elemental data and knit it together in a bigger data warehouse with primary care data, secondary care data, community data, they were then able to analyse and see, up to the point before we had the social prescriber, what were the GP attendances like? What were A&E attendances like? What were the readmissions into hospital like? And then post that service being brought into place, what differences that made. And we've got a fantastic case study by one of our customers that shows a huge improvement and a huge cost saving to the wider NHS economy because of the interventions being placed by their workers.
That's great. And anything like that you'd like to share with us that we can put on to the details of the webinar would be really useful as well, Deborah. So yep. I'd love to see that, absolutely.
I'll do that.
So we've got no more questions for you, Deborah. You've answered everything. I think it was really interesting, you know, to see that, as you say, pulling people together is an innovation in itself, really, isn't it? Creating that platform and enabling others to access it is really invaluable, and something I can't wait to get on and see what's around my area.
Absolutely.
Yeah. So brilliant. Thanks very much, Deborah. That was fantastic. So thanks everyone for your questions. I'm just going to welcome Andy Kearns. I'm surprised that he needs an introduction. So we are 10 minutes earlier, which is great. You know, doing so well on time. Andy, would you like me to share that recording? Before, you just want to give me a shout when you want me to play it?
We do it at the end as a nice little finishing ones there. So can people see my screen now? I'm not quite sure with Zoom.
I can't see you sharing anything now.
Right. Okay, so Carla's kind introduction. So I think a few of you probably know me. So it's Andy Kearns. I'm the commercial program manager at the Innovation Agency, and my role is supporting SMEs in the Liverpool City region. So I think we might have a couple of my colleagues on the call I saw earlier. So the Health Matters programme is 3 separate programmes covering Lancashire, Liverpool City region, and Cheshire and Warrington. So just a little bit before, because I think the title was sort of Innovation at Pace. So I'd just like to sort of say, so the Innovation Agency gets its funding from NHS England, NHS Improvements, and the Office of Life Science, and the Health Matters programmes are funded through the nice blue flag at the bottom, the European Regional Development Fund, the ERDF funds. So we're doing that in collaboration with the university. So just on that's where our sort of commissioners are, and the sort of the innovations that we want to sort of get spread is sort of mandated a little bit from some of the ones from the OLS. So we've had funding from sort of technology tariffs and technology programs and SBRI, small business research initiatives, which are looking to try to get innovations adopted into the system. So primarily within NHS settings, but we also work in the social care settings as well. So it's just sort of conscious that some of those do come from the centre, and the role of the commercial team is looking to support specifically SMEs and companies to help that innovation, because we know it is a challenge to get innovation and adoption of innovation into that social care setting. So that's just a sort of, I suppose, a little bit of scene setting really, that we're in that sort of position at the moment. So the sort of programs that we've had, we've learned a little bit. So this is a sort of second round of ERDF programs that we had. So we had ones running from 2016 to 2019. And one of the feedbacks that we got or received really was the barriers to sort of entry for an SME is to try to provide some of that evidence that something actually works, and that when they're speaking to commissioners or clinicians, that they can sort of say, yes, we've tried a pilot or trial and we have got some evidence that it is being successful and it is actually sort of working. So the follow-on program we've got is called sort of Health Matters, and as I say, there are 3 programs running across the Northwest Coast, and we're working in conjunction with university partners to try and do real-world validation. So I think Carla mentioned at the very start, there is some Moodle courses that are running that's starting this week that if you do have an idea and you have got some evidence, or you're looking to get evidence, then it may be appropriate that you sort of work with us and you work with one of the universities. So in the Liverpool City region, I'm working with Liverpool John Moores University, and our sort of target is to try to do 45 real world validations over this 2019 to 2022 period. So it is a sort of rigorous, but it's not randomized controlled trials. It's working in a real world setting. So it might be a care home, it might be a trust, it might be a school. So the settings can vary, and the Innovation Agency and the commercial program managers can help select some of those sites for you. But that's the criteria, is to try and to get some of that evidence to enhance your value proposition, to build your business case, to help support you working in that area, to get some of that evidence, to be able to get contracts, orders, and be successful on that front. So we have been successful previously, and these are some of the sort of targets that we've got for the new program. So 70 businesses to support for myself in the Liverpool City region. So probably working with in excess of 30 at the moment. So we're sort of doing well on those. Part of it is a sort of, because it is a European program, we sort of marked to provide business support to sort of SMEs. So people will ask who qualifies to be part of the program. So one of the criteria is that you haven't received more than 200,000 euros of funding over the last 3 years. It's called de minimis, but you don't need to worry too much about that. And your company is less than 250 employees. So again, sort of, and probably most of the companies that we get approached are happily well under that. We probably work with quite a few micro companies under 10 employees. Probably 10 to 25 is sort of more the average, and a few sort of larger ones over that particular sort of space or scale. So again, program there to support people. Where you are with your innovation, it can be from the idea stage to you've got invoices that you've been successful and you've got orders for. Ideally, we would like companies to be sort of at a sort of pre-commercial point, or that they're already selling products into social care, health settings. But as I say, we're happy to support people with ideas or just those concepts, really. But it would be nicer if we can sort of work with you further along, because obviously we're aware to actually get from an idea stage into fully adopted in one slide. I think it's can be marked as 17 years. So I'll be well gone before we get to that particular point in time. So sort of technology readiness, we prefer people to be a bit further along the line, but we're happy to have conversations with people that are at that sort of idea stage and sort of developing that as they go along. So the innovation agency, so we're around that collaboration and networking point that we want to sort of connect up. I think we're classed as an academic health science network, which is a bit of a mouthful in itself, but our strength very much is that brokerage, being an honest broker and being able to connect in networks. And we do want to support that innovation. So the commercial team, as I say, the 3 commercial program managers, but it's slightly wider than that, where you have a sort of European thread to the sort of what we offer. So we're supporting in excess of 20 European companies that want to work in the Northwest Coast and want to work with the innovation agency to be supported in this particular space. So there is opportunities for crossover, really. So the international European companies that are here, some of them obviously don't have a grounding or a base in our area, and they want to connect up with it, maybe the universities or trusts or CCGs. So again, it's trying to understand what the priorities are of the system and then sort of linking in to those international companies. And some of those are quite happy to work with local SMEs if they're sort of more digitally aware, or they've got good connections and they've got footprints in the locality. So again, can be opportunities to connect into the system at a sort of a local level or a sort of a regional level, just understanding what the opportunities are across the system. So what's our offer as a sort of part of the commercial team and the innovation agency? So it's trailing to, there's quite of areas, because the NHS, 1.5 million people, it covers a multitude of sort of areas, from sort of workforce, facilities, parking to medtech, digital. So one of the things that we try to share with SMEs or people starting off is to sort of understand what the NHS is about and how you do business with the NHS. So it's not selling into the NHS. If you approach clinicians or people that you've got something that you want to sell to them, they will put up barriers and they will sort of run a mile. And it's guidance around new products, ideas. So using the Brexit word, we'll be past the transition ones, but then it's what approval process is. So again, we can sort of help to guide people what CE marking or regulatory requirements are required, depending if you want to stay just within the UK market. But if obviously you want to look to have a European sales, again, it's sort of something that we can sort of guide and navigate you through. And again, building that evidence space, helping with that. And then some of the studies to provide the evidence, whether it's health economic analysis, and building on those studies, again, with some of the work that we're doing in collaboration with the university. But if it's a bespoke requirement, then we do know of other health economists that we can help you work with. So I don't know whether Debbie's on the ones there, the call today. So we do have focus group, and we're very conscious of trying to engage patients at the start of the process. Certainly digital ones are notoriously bad at coming up with solutions and not having engaged with patients at an early stage to understand what the problem is, and if they're actually addressing a problem that the system thinks that needs addressing. So access to introduction to potential customers. So again, it's that networking ability to get into, be able to contact people that are knowledgeable in their particular areas of expertise, and for you to have sort of conversations with them to sort of say whether or not your particular challenge or your problem that you're trying to address meets their particular need. Helping with sort of case studies and sort of promoting that. So we have a very strong comms team there that can help develop some of those case studies, and a sort of a high level. Some of our commissioners, the Office of Life Science, want to see some of the case studies that we are developing. So again, trying to spread that innovation outside our particular region. So we're conscious that if it works here in Liverpool, it's equally likely to work in Manchester or Maidstone or wherever across there. So again, linking into our partner AHSN networks. And again, those connections with commissioners and procurement leads. So we have quite strong links with the commissioners and procurement. So again, they always want to know at an early stage of what your offer is, rather than sort of rocking up when everything's been developed and you think you've got the solution. So it's engagement at a sort of earlier stage, and establishing that collaboration with sort of the NHS. If there is trials, again, working with certainly in Liverpool Health Partners or SCN to understand what you need from your innovation to sort of help move it along that time scale to be able to develop it. Bid writing and support tenders, we won't write these for you, so you obviously are the knowledge experts in these particular areas, but we will support. We sit on the other side on some of the actual sort of reviews for Innovate UK, SBRI, so some of our colleagues are actually sort of assessors, so they have first-hand experience to be able to offer guidance and refinements to any of your bids that you might be submitting. We also look at sort of funding opportunities, so the AHSN network does a funding newsletter. I have done some funding newsletters myself, so if I get the capacity, then I'll continue to do that. So there are the main ones, Innovate UK, whether it's health foundations, but there are lots of charitable ones, NIHR, National Institute for Health Research, put out regular calls. Obviously, there's quite a few COVID ones still going on. So again, these are things that the Innovation Agency and the commercial team can help. So I thought I'd just pause for a moment to see if there's what support you as a group are looking for, or individually that you think you might, it can be from the Innovation Agency or just the commercial team. So I don't know whether Carla can manage any comments on the chat or questions and answers.
Absolutely. So, and if you also wanted to speak, I can unmute you as well. And just while you're thinking of that, so what support that you would like to receive, or what do you think would be beneficial in in the work that you're already doing? I've also made Deb a panelist, and so Deb, I just wondered whether you'd be able to talk a little bit further about the work that you're doing with the patient and public involvement, and how that can also support some of the innovations and help at pace to develop those.
Yeah, thanks, Carla. I've not got my camera on, but oh, hang on. There we go. Sorry, I wasn't expecting this.
No, I always do this.
Yeah. I know, I'm used to her. So yeah, I'm Debbie Parkinson, and I lead the patient and public involvement groups. We have two that are we call our patient and public involvement senates, or PIEs for short. I live near Wigan, so it has to be PIEs. We help various SMEs. We do real world trials. We're assisting with real world validations. But as Andy said, our aim is to do true co-production, so to help SMEs right from the very beginning. By the time you're asking for feedback, it's too late, because you've already developed something. And usually my first question is, what budget have you got for the work that we're going to do? And they say, well, what do you mean? We've already developed the project. But if patients and the public don't like the colour of the app, the wording of the app, then you do need to change it, or they won't use it. So getting them involved right at the beginning is obviously beneficial. Our patient groups come from lots of different areas. They have expertise in various different programmes, or are just experienced members of the public. They help with bids, with bid writing. We've just done a bid for an alcohol-related brain disease. We got the first bid that our patients are involved with for 120,000, and we're going for the next stage now. That work's been done for I think it's 250,000. We're doing some more with COVID work, and the patient safety group. We call them pasties for short, because we've got pies and pasties now. So we've got they are dedicated to the patient safety programme, so medicine safety, maternity and neonatal care, and also the deteriorating conditions of which COVID is very much a part at the moment. So if anyone's got a need to involve patients, if you want some support with innovations that you're doing, then obviously go through our commercial programme managers. We've got Andy, Indy and Steve. I don't know if they're on the call as well, but if you go through them or contact me, I'll put my email address in the chat and I'll talk to them as well. So yeah, if anyone's got any questions, stick them in the Q&A and I'll do my best to answer them too.
Great, thanks very much, Deb. So just looking, it doesn't look like we've got any questions in the chat, but what I'd like to say, Andy, really is, you know, what's the best way to go about getting in touch with you for those things, and as well as Debbie, is it our information at info@Innovation Agency website, web address?
Yeah, any of that. I think the info one is probably the best one, because it sort of captures that and it does sort of get triaged and it tends to sort of go to the right person. So by all means, my details are on the website, and I think most people sort of know me now. So you're happy to sort of drop me an email either way, really. So happy to do that. I was just going to go on just to say, so from what the support you're looking for, I was just going to show what the offer that we're sort of putting together really for people is. So I've just got a few more minutes, Cara, if that's okay.
Yeah, absolutely. Thank you.
Okay, so we're running some Excel webinars events. So there were workshops pre-COVID, and obviously when we get the vaccine we will probably go back to those again, but we're looking to run what's called Excel into Health support packages. So they will run from the 13th of January and then be repeated on the 10th of March. So there is a link there. I know you're going to send out the slides there. So that's really the sort of offer. And then the link below that is around the evaluation of your innovation. So you touched on that before, Carla. So those the Moodle sites where people can sort of register. So it is something we're still developing and working on, but there is a sort of a cohort that just about to start that particular process. But we will look to run it again, and it's probably something we want to share with the wider AHSN network and others. So I know there are other companies in Liverpool that may not be sort of health, but the sort of criteria of getting evidence and what you need to get to evaluate your innovation is something that sort of is quite sort of pertinent at the moment, really. So they're useful resources you can dip into. So on the actual sort of webinars that we're running, we're going to be running 8. So just they're self-explanatory on there, and obviously they go into details. I think they're run at Wednesday lunchtime for an hour, so you don't have to do every one, but obviously if you're sort of new to the NHS landscape and the system, and you're just starting off as an SME, then they all of them may be of interest to you. So talking about the landscape, procurement, commissioning, procurement towers, frameworks, G clouds, all lovely acronyms to sort of help, and these are ones that we can help navigate you through and sort of guide you and point you in the right direction to understand sort of how you can sort of grow as a company and do business with the NHS, understanding the culture of the NHS. So if you're from the sort of private sector, then it is a sort of a different beast completely to what you've probably experienced, and this tries to get over a little bit of understanding of what that culture is and how you might navigate your way through it. Understanding your value proposition, how to build that, what evidence you need, and then a business case development if you're sort of looking to develop the company, what your plans are, what the strategy are. So these are sort of basic tools and supports that's being sort of offered, so it's the options for you to sort of dip into that. Touched on the real world validation, and then sort of pitching skills. You're actually going to need to pitch this at some stage, your idea, and we'll go through some practice pitching. So some of it can be just around your innovation, but also if you're wanting to grow your company, you may need to pitch for funding as well. So we talk about that opportunities, and then we can sort of also link you into potential funders, whether they're angel investors, venture capitalists, or it's business banks. So there are a multitude of funding opportunities there, and we can help sort of hone your pitches depending on what the sort of audience is. So yeah, that's some of the offers there. I think you mentioned as well, Carla, about sort of where you would maybe go with your innovation. So we link in with what's called Health Tech Connect. So if you've got an innovation that you want to sort of spread to the wider system, that can link into NICE, procurement pathways. So again, and there is the innovation agency is joining up and following the sort of process that Manchester Health Innovation Manchester is using around the sort of a pipeline approach for innovations. So again, these are things that we can help support. The innovation agency has an innovation exchange where we do that in collaboration with Yorkshire and Humberside. So it gives a sort of platform for innovations or ideas, or some of the ones are just asks at this stage as well. So again, these are multiple offers that the commercial team and the innovation agency is putting together. So yeah, there's a suite of offerings there, and if in doubt, then just drop us an email or give us a ring. And then it's any questions really. Oh, do you want to play the little link from one of our SMEs?
Yeah, lovely. So if you want to what is the link then? So I know that it's Red Ninja. Do you want to introduce anything about it?
Yeah, no, it's Leomar from Safe Steps. So one of the other offers is we help support NIA fellows, NHS sort of accelerator program for people with innovation. So Lee is one of our, we've helped support him to be one of the NHS innovation fellows. So we've been working with him for well, probably the last 3 years, and over the last 6 months they've been quite successful. They've pivoted for the COVID activities in Manchester, and it's just sort of showing sort of, I suppose, what the wider team at the Innovation Agency can offer to help support SMEs, and Lee's just been kind enough to give a few words of what support he's received.
Lovely, thanks very much, Andy.
My name's Lee Omar. I'm the CEO of Red Ninja and the co-founder of Safe Steps. Thanks to Lorna, who helped me with my application and gave me some great pointers of what the assessors were looking for. We've been working a lot lately with Katie Whittle. So she's been providing support around Restore 2 and News 2. Now, this is something that we needed to digitalise and put into our platform. Andrew Cooper, patient safety lead, has been instrumental in connecting us into the care home network, and also the new kind of recovery space in the Liverpool City region, which is helping us get traction to hopefully scale across the STP in Cheshire and Mersey. Ed Millenstead has been leading on the outline business case for this. I can't really overstate how important this is to a company like Safe Steps. It's the first time that we've got something in like NHS language, and something that really shows the value of what we do. So thanks, Ed. Laura Bolland's been providing support on HES data, and again, that's something that we wouldn't have had access to, and that really helps us with the business case. Phil Jennings, we really respect Phil's kind of clinical expertise, and he helps advise on the kind of regional priorities, and is a great sort of source of support for us. Finally, Liz Meyer, with her sort of national profile and network, has helped connect us into other CEOs of the AHSN network to help with the national rollout, and also Ian Dodge in the NHS England and NHSX board, and so it really got us at a different level, and Liz's kind of strategic thinking and knowledge of the systems being invaluable. So yeah, we really couldn't be doing this scale and growth without the help of the Innovation Agency.
That's great, Andy, and I think the message really is about, you know, around innovation, you know, come to us and let's see what we can do in terms of support, whether that's the culture arm or whether, you know, there's lots of other things that even just striking those conversations. And I think that one of the things that Debbie's wrote in the chat as well is another offer around the patient involvement groups, so there's a dedicated patient safety program, and you can contact Debbie there. I'll make sure I send her details, and the other one was Innovation Agency. Lovely. So the last thing for me really is just to sort of summarise what we've done at this webinar today. So as I say, we've looked at the different programmes that we've got. So we've got innovation mindset. So if that's something that you're looking for and you want to really develop some of those skills for yourself, that's great. We've got evaluate your innovation. So really looking at the language and helping you to put some of those benefits into words, and lots of other things that's on there for a 6-week program. We've also got coaching collaboration spaces every Wednesday. We've got Andy Kearns' launch of the Excel in Health program, which I think I'll be going on that. If you can help me to look at the NHS structure, that would be fantastic. great to hear from Deborah. Really moving story, and I think if you have the ability to work with anyone from Elemental, absolutely those values that you started with are totally there. We had the pleasure of working with Sonia on one of our programs, and I will say that the staff there live and breathe exactly what it is that you want to achieve, and I think that's absolutely been integral to the pace of that innovation. So it really comes across. So thanks very much, Deborah, and I know we'll share your details and the case studies that you've mentioned too. And then just a final thank you to Andy Kearns. He's the program manager who is always helping me to get this information across. I seem to always be gravitated towards you, Andy. I'm really sorry about that. I think for me it's about not only are we here to support, but we have lots of different skills and expertise in our commercial team that can also you know, with loads of different backgrounds, that is really interesting and help you to take some of that pressure off. There's just one question I've got for you, Andy, and it's about if I was to really want to understand what innovations are out there at the moment to help, you know, spread or maybe even choose some of those from your own organisation or the work that I'm doing, how would I go about doing that?
Well, we do have the Innovation Exchange, so that would be a first port of call. Orca are quite a good sort of digital platform that review apps locally. So they have sort of closed their sort of open platform, but I don't know, so someone had an inquiry about eating disorders, or then they're a good sort of place to start, really. So there are quite a few. That's one of the sort of challenges with it. Within the system is there are lots of places where you can sort of look for innovations, but I would have a look firstly our Innovation Exchange. Orca is quite good ones for digital apps. There's the NHS App Store, but I think that's sort of limited in it is being revamped. So or drop us a line and we can sort of do a little bit of horizon scanning, just with a sort of caveat that we do have other things to do as well. So it's sort of could be sort of time dependent. So yeah, I would say that there are, I think Fab Stuff is another one where it's a website where you can sort of look at innovations. The sort of AHSN network, they've got an Atlas website where again, there are products that have reached probably a higher level. Health Tech Connect again is ones there where it sort of it does show a list of innovations locally. The Alder Hey have a portal for innovations where it's a two-way ones where you can actually submit suggestions or ideas to see if people are interested in that. So there are quite a few. There is, unfortunately, there isn't one that sort of one shop stop for all, really. I think you do need to sort of go around and sort of search. Before we finish, I think my colleague Steve did put a sort of a little shout out. So the 8 workshops that we're running, if any of the scouts are interested in supporting that, so we know that we're not experts in anything, so any help, so one around I say culture of the NHS, if that's something that you're familiar with, then that might be something you could support. Or to extent, if you are in a procurement team and you want to sort of share some of your knowledge with us locally, then again, we'd really appreciate your support. So it's not asking you to do all of it, but if you feel that you can help and support, then it's sharing that information, really.
Lovely, that's great. It's almost like that portal's needed, Deborah, for innovations as well as social prescribing. So if anyone else has got anything you'd like to add, Deborah?
No, just thank you.
Good, lovely. So thanks everyone very much. Again, everything will be sent out by our organised Molly. She will make sure that you get all the links and everything. Andy, if you could send some of those links that are as well in your slide, but any of the other stuff that you mentioned around the health tech links and things, that would be really useful. All right, everyone. So take care until the next webinar, which is in on the 25th of January 2021. Yeah, so I look forward to seeing you all then. Thanks, everyone. Take care.
Thank you. Bye.